Hi, now let's discuss about the evaluation test for disease diagnostics. Let's say as a biomedical engineer, you're developing a new test or new instrument, bioinstrument, which will diagnose the disease. Then you must consider about the accuracy and precision, and at the same time, so-called sensitivity and specificity you have to report to get it approved. So this is a very important concept to know if you want to make your instrument to be able to out in the market. So let's first discuss about the sensors used in biomedical instruments. So there are different kind of sensor types, which is a thermal sensor, mechanical sensor, electrical sensors, and chemical sensors, and optical sensors. And there will be sensing element, and I'll give you some example. So first, thermal sensor. The sensing element, you may have heard about a thermocouple and also a thermistor. So let me have an example of electronic thermometer, which measures our body weight, body temperature. And second, as a mechanical sensor, those sensing elements could involve a strain gauge, which I will discuss further, and or piezoelectric sensor. So piezoelectric is a kind of a displacement or pressure can give rise to a voltage. So here's an example as I put this piezoelectric transducer, which when we apply voltage, then this piezo will have a change. So in this case, a changing in displacement. So an example as a pressure transducer, one type of pressure transducer I actually used is a piezoelectric, so that we measure, let's say, gas pressure in a specific vessel. There's a specific gas, and I want to measure the pressure. We have a piezoelectric transducer that measures this pressure, gives rise to a voltage difference, and that we can measure. So that's another example of pressure transducer. You see, transduce means converting one type of signal into another form. And thirdly, electrical sensor, one example is electrode. For example, like electrocardiography, and that's like this. We have already discussed these electrodes are sensing the electrical activity of our heart, because the heart's cardiac myocytes generate electrical field and electric vectors. And chemical sensor, an example as a sensing element, we can also use electrode, especially a good example is a pH meter, which looks like this. Many laboratories have this. When you are preparing a solution with a certain pH, then you have to use this pH meter to measure the pH, and these are the electrode. And lastly, I want to discuss about optical sensor and sensing element, which measures the photon, the amount of photons or light. So a typical one is so-called a photodiode, which is cheap and broadly used. And the other more specialty ones are photomultiplier tube, which is very, very sensitive, even giving us a single photon sensitivity. So we'll discuss more about this. And what are the examples of this optical sensor? And one of the vital sign and important ones, pulse oximeter. Now, a pulse oximeter uses a light to having this transmitting through our, let's say, biological tissue where there exists a blood vessel, so that we can measure the oxygen concentration, saturation of the oxygen in the tissue. Okay, so now let's discuss about when we develop a new diagnostic test. Let's say we have this machine which, let's say, measures some body fluid of patient, and it gives out a result saying that, hey, you've got this disease or you are free from the disease. then how can we characterize the performance of this diagnostic test? So for this, people have developed a very simple decision matrix. So decision matrix is about like this. So first, in an absolute sense, like the patient will have this disease or no disease. So that's what we ultimately want to know. However, that's not very easy to figure out. So we develop an instrument, or bioinstrument, which spits out the result as a value, quantitative value, that we will, based on this value, we will say, hey, this is a threshold and you are higher than this value, hey, you are positive, which is like from our test. Or below, that's a negative. So positive and negative of our disease test results and the absolute sense of disease present or absent. And with those 2 by 2 table, we can now characterize our performance of an instrument. So here you see disease present or disease absent, and disease and no disease. While test side, we can always set certain criteria and having it as a test positive or test negative. That with this, what we can say, what we are interested in, what the true disease or not. So having disease and getting positive means true positive. Make sense? And having no disease and getting negative is true negative. So these are like the true estimation. And while there are other cases, having, I don't have a disease, but somehow this test result giving me damn positive. So that's false positive. Okay, but I do have a disease, but this machine is not good enough to giving me a negative. That means a false negative. Does that make sense? So this is very simple decision matrix, which gives us to define more specific performance metrics. So for this, like we can say, like everything, every case is disease plus no disease, right? Or we can say there's only positive or negative. So all the positive plus negative, which means all these 4 elements sum together. So true positive, false negative, true negative. So that's all. And what are the positive? So positive is true positive plus false positive. Okay. What are negative? True negative plus false negative. What are the disease? So disease can compose of true positive plus false negative. Likewise, no disease will be composed of false positive plus true negative. So with this, we will define more specific parameters. So for that, let's consider about, hey, what's the accuracy of your test or your machine, okay? So for diagnosis of disease, the accuracy can be defined as the degree to which the result of a measurement confirms the correct value. How accurate? How can this machine give the correct value? So we are more interested in correct value, which means in the disease matrix, correct one is always true. So that accuracy can be defined as true positive plus true negative case. Out of what? All the cases. So that's all. So why it's all? Let's see, disease, no disease, positive, negative. We are interested in the proportion of true positive and true negative out of all. Okay, so that's all, means everything. And this also relates to confidence interval, which means to the what interval the true value of this population will likely to lie. So, and the other aspect we've already discussed, and I'm talking about precision, is the ability of tests to reproduce the same result. What it means is, let's say I want to measure my height. So I'm having a ruler to measure my height once, and I write down the result. And I do measure it again. Second time, oh, the value will not be always the same. Let's say another person came in to measure it, and that values are also different. So, this is like any instrument we are measuring, you will not have exactly the same value. So there comes the concept of how repeatable those measurement values are that we call as a precision when repeated on the same patient or sample. So that's related to really standard error or standard deviation or repeatability issue of our instrument. So that's a simple diagram, which I call it again. You see the distribution of the results will be more compact. Distribution is more compact. So upon this C and D is higher precision. While we also accuracy matters, the mean is not at the center. So this mean is not the center. So this is even high precision, low accuracy. However, this is great. And in this case, hey, it may not be precise, but when you measure it over and over and make a mean value to represent the center, that will be pretty accurate, okay? So now I want to discuss when you are developing a bioinstrument, which is for, let's say, disease diagnostics, then you want to get approval. Then the people who want to buy or commercialize your device will ask you, hey, what's the sensitivity and specificity of your instrument? Then, wait a second, what is sensitivity and specificity? Okay, so we have to know the definition first. So there's a simple 2x2. This is a matrix, and let's see why we need to know about sensitivity and specificity. So that's what people will ask you. So to evaluate the performance of a test or assay or a bioinstrumentation, what you have to diagnose a disease, these are the important parameters which belongs purely to that instrument, okay? So the definition of sensitivity is the probability that an individual who has a disease, we want who have the disease to test positive. That's sensitivity, okay? So how do we define sensitivity? Yeah, the amount of true positive among those who have a disease. So sensitivity only matters for a population who have the disease. So that's disease. And disease composed of true positive plus false negative. From this formula, you can see higher sensitivity means you have low false negative. And false negative means those who have a disease, but test result turn out to be negative, okay? That's false negative. So what does high sensitivity mean? That means if you truly have a disease, this device is likely to give you positive result, okay? So that this high sensitivity device will not miss many patients who actually have the disease, okay? Or which means low false negative, or false negative rate. If you take 1 minus SN, then will be false negative out of those disease. So sensitivity really means we are curious about, hey, someone has disease and this test should give you a positive results. That's about sensitivity. Then you can think of the opposite case. Hey, I don't have a disease and I have this test and I want to have a negative results, okay? So that is related to specificity. What it defines is a probability that an individual who do not have a disease will test negative. So that, hey, the definition of specificity should be, hey, someone who has no disease will test negative. So no disease, out of no disease, the test will be negative. No disease is composed of true negative plus false positive, like this. So what does it mean by having highly specific test? Means you need to have very low false positive. And false positive means, hey, I don't have the disease truly, but the test give me a damn positive, okay? So high specificity means infrequently identify patient as having a disease when they do not have the disease. So let's reiterate, think about this. So high sensitivity means you are less likely to miss the disease by using this instrumentation. On the other hand, high specificity means this test will less likely to misdiagnose a disease. So it's quite important, but it can be also confusing. So specificity involves only those population who do not have the disease. Okay, so let me give you a quick quiz. So I will talk about this, both sensitivity and specificity, higher the better. But unfortunately, there is always a compromise, which I will discuss next time. But let me ask you a question. Which ones are more important between sensitivity or specificity? Let's say early stage cancer. And think about the disease of early stage cancer means cancer is very, very important disease because it can be fatal. So early stage, if you don't diagnose well enough, for example, if you miss the early stage cancer, then it turns out to be real cancer later on, and later stage, you already know it's more fatal. So it's very important you do not miss the disease because you can treat the course of disease if you find it at an early stage. So if you have a test which will diagnose early stage cancer, you make sure you have a high sensitivity. Does it make sense? Let's think about another type of disease. Let's say there's no a good cure of the disease, no treatment. Okay, so even if you know that you have a disease, if there's nothing or not many things to do for the patient, that will aggravate the patient or give burden to the patient. So here's an example. Let's say Alzheimer's disease. To date, if I know that I've got Alzheimer's disease, there's not much thing I can do. Then what if I misdiagnose it? So I actually do not have Alzheimer's disease, but this test will give me a positive, so which is a false positive. Then, because of this, I feel, I have to know whether I really have Alzheimer's disease with this test. So I have to undergo, hey, I need a more accurate test, which will be costly. So I undergo follow-up exams, and that gives me more burden. Okay, so but the problem is, even if I'm truly getting the Alzheimer's disease, there's not much thing to do. So in this case, in this type of disease, we don't want to misdiagnose. Okay, so that for those patients who do not have disease, don't want to get positive result. In this case, what matters is high specificity. Hopefully this makes sense for you. And I want to get involved more about sensitivity and specificity because when we develop an instrument, you somehow have to binarize or demarcate whether positive or negative. That threshold value is what you set. So how to set the threshold is important. So let's see a practical case of a disease and your instrument. So this x-axis is the test value, a quantitative value your instrument will give out. Okay, the y-axis is the frequency, the number of cases. So then, in the true point of view in the disease, there will be disease population, let's say, is in this case, it looks like a normal distribution, which is having higher value, let's say, and no disease will also have this population. But you notice that they are actually overlapping in gender. That is the issue. So disease population is this curve of distribution. Non-disease population is this curve of distribution. And you somehow make a line that on bigger value of this line, you call it positive. So positive. And lower than this line, your instrument will say, hey, it's negative. And what you notice is positive not only have disease population, but also it's non-disease. And this, of course, is called false positive. For those non-disease population, majority will be negative, but you see, hey, even disease population can belong to negative. That means it is falsely negative. Okay, so this value is called cutoff value. So that cutoff value must be chosen to separate normal from abnormal. In this case, we call positive and negative. Selecting this value always involves balancing sensitivity and specificity, although the actual value may vary. So what does this mean? So we know from the definition of sensitivity, which is out of disease, the portion of true positive. Specificity is out of non-disease, the proportion of true negative. So you can see here, let's say if you have cutoff value to higher value, then you see false positive will be smaller, and smaller false positive will increase specificity, okay? While false negative will increase, so that means sensitivity will decrease. So you see the opposite effect of setting up your cutoff value higher will inevitably need higher specificity while lowering sensitivity. Vice versa, if you put your cutoff value lower, then what happens will be you can increase sensitivity that you are really not missing much disease, but your specificity will decrease. Does it make sense? So it's like always a compromise. There's nothing you gain everything, right? So with this, next time I'm going to discuss about more positive predictive value and negative predictive values. Thank you for your attention.